Hi, I'm Dr. Michael Craig. This is Dr. Spine in India. Today I'm going to go over something of importance to most of you. In fact, probably half the people that come in our clinic are suffering from low back pain. Low back pain, hip pain, leg pain, foot pain, etc., ankle pain and so forth. If the pain is radiating down the back of your leg, you definitely have a low back problem because that's called sciatica. Sciatica is the nerve, or sciatic nerve is the one that exits the spine, usually at the level of L5-S1. This is L5-S1 on X-ray. That's the most stressed part of your spine, by the way, because your whole upper body has weight on that particular joint. So as chiropractors, we're very interested in giving you an understanding of what low back pain is and how it comes about, because you're going to have low back pain sometime in your life. If you're any age at all, over the age of 40, chances are you're going to have low back pain either as a young person or you're having it now. If you're having low back pain now, maybe this video can help you understand a little bit better what's going on, okay? And I'm going to try to give you a little bit of an idea of that. Okay, so the first thing is to understand that the spine, chiropractors work on the spine. We don't use drugs, we don't use surgery, we use our hands, and sometimes we manipulate energy, move energy around to get the spine back into what we call a balanced position. Now, what is a balanced position? Well, a balanced position is everybody has hips. If we're looking at your hips here, that's the X-ray version of the hips. And these openings right there represent the foramen. And sometimes the foramen, these openings, can tell me which way the hips are rotated. So if the hips are rotated, this is like your foundation. If you rotate your foundation or tip your foundation, what's going to happen to the house? Well, the house is going to lean. Your walls are going to lean, your roof is going to tilt, and then your shingles are going to fall off. So a hip, a foundation, can also affect your neck, your shoulders, your upper mid-back, and many other things in your life. So you want to make sure that your hips are balanced. As a chiropractor, my first attention is to do what is called a leg check. It tells me the condition of your hips, and when the hips are balanced, then I work my way up, and then I go into the low back. Except initially. Now, if you have a severe low back pain, and you can't stand up, you can barely move, you have pain running down the back of your legs, I don't do a lot of the stuff. I just bring you in and we start treating right away because you want to be out of pain, obviously. So without drugs, without surgery, we can help you feel better. In most cases, not in all cases, but in most cases. And what we do is we have a special table that can contract or open up. Not contract, I'm using the wrong word, it's distract. We use distraction, or we spread the vertebra apart just a little bit to take pressure off the nerve roots. And these are nerve roots, the nerves that come out from the spinal cord and go down into the hips, into the knees, into the legs and feet. So the sciatic nerve comes from here and maybe to a lesser degree from the L4, L5 vertebra. You've got five vertebra in the lumbar spine, you've got 7 in the neck, and you've got 12 in the mid-back. We're talking only about the lumbar vertebra here because most people have problems in the lumbar. So if you have problems like that, the first thing I do is balance out your hips. The next thing is I make sure that we're dealing specifically with the sciatic nerve. If that's the case, then this distraction machine, or machine that we put you on, it's actually a specialized table that bends at the waist, which allows us to pull that vertebra apart, take pressure off the nerves, and give you some relief. If that works, then I can know that this is a sciatic problem. If it doesn't work, you may have another problem, either in the sacroiliac, or it could be further up in the spine. In which case, I also have moves where I put you on your side and I adjust the spine while you're on your side. It doesn't hurt in most cases, and you get almost instant relief. Now, instant relief is relative because if you're in a lot of pain, chances are you might get some relief, but you're not going to get complete relief. It may take a while. Most people that come in think that I'm a magician and I can perform miracles right away. That's simply untrue. I can't perform miracles. Your body, however, can. Your body performs miracles all the time. Now, if it's meant to be, and I do an adjustment, and you get totally relieved of pain, that's wonderful. But I'm here to tell you, chances are the pain will come back. And you probably will need several adjustments in order to correct that condition before it stabilizes and the pain no longer returns. So that's all I have to say about low back pain. The leg pain, sometimes if it's on the side, sometimes if it's in the front, it could be affecting other nerves that are higher up in the lumbar spine. But in any case, we can normally treat low back pain by adjusting the spine and doing that. On rare occasions, you'll have low back pain that doesn't have anything to do with the spine, but it does have something to do with something called the psoas muscles. These are deep muscles in the spine, in the body, the abdomen, that affect the condition of the spine and can cause, if they spasm, can cause severe low back pain that way. There are other causes of low back pain, most of which are too obscure to go in during this video, but I usually check to ask questions to find out where the cause of this pain began. Usually it begins when you bend over and lift something. The mechanics lead itself to low back pain right away. Come see us. Give Dr. Spine Clinic a call, Dr. Spine Chiropractic Clinic. We have clinics all over Bangalore, and soon we'll be expanding all over India. So let us know what you need. Give us a call, and you can usually look in the description to find the number there and let us know how we can help you. I'm Dr. Michael Craig with Dr. Spine. Thank you for joining.